Today on At Your Service, we will be discussing the very current concern of opioid and heroin addiction. You will not want to miss it.
Today on At Your Service, we'll be discussing a national epidemic, opioid and heroin abuse. And today we have a special guest, Ms. Angel Trainer. Welcome, Ms. Trainer. Can you just give the audience a little bit of background about your expertise and your experience in the field of substance abuse and addiction?
I can. My formal education, I have a couple of degrees. One is in addiction counseling and the other one in social law. Mm-hmm. My daily education comes from working with, on the average, 40 ex-heroin users who have entered a lifestyle of recovery. And then my personal experience is that I'm a person in long-term recovery, meaning for me that I've not found it necessary to use heroin for a little over 10 years now. For 33 years before that, all bets were off.
Right. Oh, well, welcome, and thank you so much for being a part of our show.
Thank you for asking me.
The HHS, the Health and Human Services, declared that we are in a state of national emergency. And I know that they said there are 5 points that they plan on addressing. And improving prevention, targeting availability and distribution of overdose reversing drugs like Narcan, strengthening and understanding of this crisis, basically better public data and reporting, providing support for cutting edge research on pain and addiction, and advancing better practices for pain management. What can you tell us how Anne Arundel County in particular, and what your experience of what you're working with your clients, what's your thoughts on this strategy?
I think that in Anne Arundel County we do a really good job on several of those points. In the prevention field, I can tell you that I'm the coordinator for a prevention coalition I'm Annapolis City, but we have 4 in Anne Arundel County, and some counties don't have any prevention coalitions. So we have 4 of them in our county. ASAP, Annapolis Substance Abuse Prevention Coalition, we work in the 21401 and 21403 zip codes. And what we focus on is underage drinking, binge drinking, and then car-related crashes for the 21 to 25-year-old group. Mm-hmm. And I think that we are very active in prevention in this county, because prevention is just so important to stop the young, to stop the younger population, the younger age group. If I had my way, we would have no new users.
Yeah,
we would.
Exactly.
I encourage people all of the time to get involved with their local coalition, and you can, in Anne Arundel County, you can find that information at preventsubstanceabuse.org, and you can just find your part of the county and join one of the coalitions. Come out and help us.
Fantastic.
So that's the prevention, and I think that we have done a very good job at Narcan distribution. Our health department trains for free twice a month, and I think that everybody should carry Narcan with them, because the epidemic is so widespread that you're liable to find someone that is suffering from an overdose at a gas station pump or in a public restroom, things like that. And the county's done a good job of getting that information out there and getting that reversal drug into the hands of just common citizens, if you will.
Now, how does the Narcan work?
So it is a reversal drug.
Okay.
It is an intranasal spray. So when somebody is suffering from an overdose, it goes right up their nose. Our EMTs, our police officers carry it on a regular basis. They have it with them. And it reverses the effects of the heroin. The heroin is shutting the body down, and it reverses that effect.
Wow. And there's no risk if they give it accidentally to somebody that they think might be overdosing but aren't. Is that correct?
That is correct. There is no risk to that person.
That's good. I know that in Anne Arundel County Public Schools, drug prevention is a huge piece that's rolling out this year. With that state support of the law that's being written in middle and high school, the lessons will be infused within the health curriculum. But for the elementary schools, starting at a very young age, there are special lessons that have been written which are age appropriate, that are being rolled out this particular school year. So parents are going to be able to see letters come home and a particular lesson be taught about making healthy decisions. You know, just developing those healthy decisions and being able to say no. So I think that there's, you know, from Anne Arundel County Public Schools, we are aligned with, you know, the health department. You're a coalition, so we're really taking that targeted focus.
Absolutely.
I think that's fantastic.
It is, and it's so important, you know, and given thought to the age appropriate, because there are things that you can talk to a 12th grader that a 3rd grader is just not going to understand,
Right.
but there are ways that you can talk to a 3rd grade child and help them with those healthy decisions. Absolutely.
Yeah, and
Definitely.
the bystander role.
100%.
Yeah, that's a piece of the puzzle as well.
Right.
Right.
And just making people aware of all the different terminology. You know, parents might not be aware, and I know we're going to ask you some questions later on about more information related to this. But I also think for parents to know that there's Narcan in the high schools, definitely in middle schools, in the health department, you know, through the school nurses that are run by the health department,
Right.
because it is such an epidemic. And I think that's the piece that people think, it's not my child.
Absolutely, they do. And I am here to report that it could be anybody's child.
Right.
You know, the population that I work with, they come to me, sometimes they're 18, 19, 20 years old, and they're active heroin users that started in middle school and high school with things that they thought were not, it was not going to hurt them. They, you know, they were experimenting, or, you know, they wanted to fit in, and all of a sudden they found themselves bound by the chains of addiction, and they have no idea how they got there, but they were there. So.
Correct. So when you look at this 5-pronged strategy through the, you know, through the Health and Human Service, through the CDC, they've all, you know, President Trump's even talked about the heroin opiate addiction. What are your thoughts on this 5-pronged strategy? It talks about, you know, prevention, overdose availability of Narcan, but the data. Talk about a little bit about, you know, public health data and reporting.
So, you know, we do a really good job of knowing the stats for what the overdoses are and what the use is. I think that where we lack is showing the statistics of recovery. Being able to show the community that it's not all gloom and doom, that there's a whole constituency of people that have overcome the disease of addiction. I feel like that's where we're lacking, because I think we do a good job with the other stats. You know, not a statistics girl, but working in the field that I am, I work with them all the time. I know them like I know my own hand, but you never see what the statistics are on recovery.
So you're seeing success,
Absolutely.
basically.
Absolutely.
That's fantastic.
That's good to hear.
Because we do hear a lot of the, you know, obviously we don't want anybody doing, but if you do it, you're going to overdose, you're going to die. You hear that gloom, like you said, but if we get them help, then
And support.
success, yeah, definitely, in the support.
It's
then,
about. It's all about the continuum of care, and you know, some of the most amazing people that I know and work with today are people in recovery, because they're smart, they're funny, and once they figure that out, there's no stopping them. And I think, you know, that the community knows what the face of addiction looks like, but I don't think that they understand that there is a face and there are voices of recovery. They just are. And you know, we could talk for an hour about that. I don't think we have time today.
Yeah.
But it's there. You know, the recovery is definitely there.
Right, definitely. Just one more, pain management. You know, pain management's huge. We talk about people becoming addicted because of operations and surgeries and pain management. This work that you do with your agencies and coalition, what is your interface with the medical community who's distributing, you know, pain management?
Right.
Is there more of an awareness?
So through ASAP, through the coalition, we work on the opioid misuse prevention programming initiative in Anne Arundel County. And what we do is we are out there and we are talking to the prescribers and we are talking to the pharmacists. We are distributing information to them that they can give to their patients, because it's all about education. You know, the patients need to be educated about what these certain drugs can do. But, you know, it's not all the doctor's faults. It's not. I mean, we as patients need to ask the questions to the doctors. What am I taking? How long should I take it for? And what can be the consequences?
What are the risks to that?
Yeah.
That's interesting.
Yeah, it sure is. How does our usage and the abuse numbers in Anne Arundel County compare to Maryland or the national? You see all these different numbers out there. So what is your thoughts on that as far as how we compare? Obviously, I know it sounds like Anne Arundel County is definitely on the ball for a lot of preventative stuff.
We are.
What about actual usage and abuse?
You know, if you look at the numbers for overdose and opioid-related issues, in 2007 we had less than 1,000. It's about 853 fatal overdoses from opioids. 2007. So 10 years later, we are almost at 2,100, and that's in Maryland.
Okay.
So in Anne Arundel County, and again I know the numbers, in Anne Arundel County, 899 overdoses, 127 of them fatal, and that was as of last Tuesday morning.
Wow.
So
That's unbelievable.
Yeah, it sure is.
It's unbelievable. I just want to go back. You had mentioned something, and I know we have about a couple more minutes before we go to break, but you talked about students that didn't realize how they got there. And you know, when I think about the parents that are watching this show and the students that are watching this show and wanting to fit in, wanting to have friends, or, you know, coping the wrong way, well, you know, I hear that's not going to hurt me. Well, what really does hurt them that leads them down that pathway? What are you finding?
So the population that I work with, and just in talking to them, I have very candid conversations with them. What happened? Just what happened to you? They will tell you that often it was an injury, so it was a sports injury, and they started taking the medication, and honestly, they liked the way it made them feel, most of them. It changed the way they felt. And when I dig a little deeper, it's because they were not happy with who they were or how they felt about themselves. Now, is that normal for a 14 or 15 or 13-year-old?
Right.
Yeah.
Absolutely it is.
Right.
If you've ever had teenage children, you know this. But they're using it as a coping mechanism sometimes, or they will take it and then the prescription will stop, but they've already become physically addicted, and often they will go outside of that and go to street drugs.
And it could be anything from a tooth pulled, because adolescents, you hear sports injuries, you know, wisdom teeth pulled, some sort of surgery that could lead to their middle school or a high school going outside and using other types of pills.
Absolutely.
And
they will seek them when that prescription runs out. They will seek them, and what happens though is if they have to buy them on the street, they're very expensive. To buy those prescription pain pills illegally on the street, it's very expensive. So often they result to heroin.
And this is Vicodin, Percocet. What are some of the other ones that are typically prescribed?
Hydrocodone, OxyContin, Percocets. I mean, Percocets and Vicodin and hydrocodones, that's what I hear the most with the residents that I work with.
So we're going to take a quick break, and when we come back, we're going to talk a little bit about the types of pills that you just mentioned. So stay tuned. We'll be right back.
Hi, I'm Jeannie Porter. Anne Arundel County Public Schools Department of Transportation is raising the level of awareness for the safety of your children as we transport them to and from school. When a school bus stops to load students, as a driver, this is what you will see. At 150 feet, the bus will activate hazard lights. At 100 feet, the bus driver will activate the amber lights. they will start slowing down. At 10 feet before the bus stops, they will turn on the red bus lights. Their stop sign will come out, and students will begin to load. Once all students are on board safely, the bus driver will turn off red lights and move forward. At this time, it is safe for the motorist to resume movement.
Welcome back. Ms. Trainer, if you could touch base more on the medicine part, the legal and the illegal that's impacting our youth, I'd appreciate that.
So if we're talking about opioids, you know, again, our kids and our adults are getting prescriptions for, you know, things like getting their wisdom teeth removed or sports injuries. And most often they're walking out with prescriptions of Vicodin or hydrocodone or Percocets. And at some point, that prescription is going to run out. And either, you know, if they've become addicted, because you never know when it's going to turn on you, when you're going to become physically addicted. So if you go back to your doctor and your doctor says no, that they're not going to refill, then often our younger generation will go out and try to buy those pills on the street, and they're very expensive. I mean, for a Percocet or a hydrocodone or a Vicodin, you're talking anywhere from $20 to $50 per pill, just per pill.
Wow.
And that makes the money run out pretty quickly, and a lot of times they will turn to street drugs, so they'll turn to heroin, which is significantly lower because you can buy heroin for $6 to $10 per pill.
Wow.
So most of these students or children or individuals, they are accidentally getting addicted. Am I hearing that correctly?
Yes. Yeah, they often don't know. They don't know that they've become physically addicted. And, you know, I've just talked to so many young people that I've worked with, and they'll say to me, you know, I woke up one morning and I didn't have the pills that I needed, and I felt like I had the flu. And I just didn't feel good, and my nose was running, and I thought I was sick. But a friend told me, no, that's not the problem here. Take this, you'll feel better. And they'll give them another opioid,
Right.
and all of a sudden they feel better. So now they know how to fix the problem. They know how to feel better.
And they might even be thinking, oh, it's not Vicodin, it's
It's
something
the
else.
different else that's
So-
not addictive.
Right.
Or I'm not, you just don't think that at that age either. That
Correct, yeah.
I was prescribed that from my doctor.
Right.
So it's going to be okay.
Right. It's safe. It's,
Right.
I'm going to be okay. As long as it is a prescription pill, I'm going to be okay. Absolutely. I've heard that too.
And
So-
there's,
go ahead.
I was going to say, I know that there's also parents out there that would be like, oh, I don't have to worry about that with my son. He doesn't know anybody that's using. So how would he ever get any of these pills?
Well,
What would you say to that parent?
Well, again, working, not only working with the younger population that I do in Serenity Sisters, I've gone out and I've actually conducted focus groups and things like that in our schools in Anne Arundel County, and those kids are telling me, they themselves are telling me that they have friends that sell them, and my question always is, well, where did they get them from? And it will come out of their parents' medicine cabinet or their grandparents' medicine cabinet, or a family member or another friend will give it to them,
right.
and then they sell it. But at some point that supply will run out, and they still want to make themselves feel better. So that's when often they will turn to street drugs, to heroin.
Wow. So one of the things that I want to just talk a little bit about is fentanyl. Fentanyl has come up just recently. We've had a lot of people die from taking fentanyl, adults and youth.
Yes.
It's a different lay of the land. This type of, it's a horse. I don't think it's a medicine that you would give to a human. If I'm, is this, or am I
It
wrong?
is.
Oh, okay.
No, that's carfentanil. So
Okay,
the
that's
carfentanil is elephant tranquilizer,
Okay.
and that's far more dangerous than heroin or fentanyl, either one.
Okay.
Not that those other two aren't dangerous, but carfentanil is its own. It is its own beast.
Okay.
But fentanyl is used for for anesthesia and surgeries. I mean, you can get it in the hospital. However, it is a synthetic drug, so there are the darker powers that will make it and sell it on the streets. And the thing that people don't understand is that while heroin is dangerous, there is no doubt about that. Heroin is dangerous, and you can overdose from it. When you have somebody who's not a doctor, who's not a chemist, that is putting a drug into another drug, because they often mix it, they have no idea what they're putting into it. And literally, it takes this much fentanyl, the tip of this pen, this much fentanyl to kill someone. And people that are addicted just don't realize you don't realize what you're buying on the street.
No.
Wow.
So.
Wow, that's crazy.
Yeah, you're just not thinking.
Yeah, at all. So, we look at that, and you talked a little bit about that flu type dependency. What are some other signs?
So if I were talking to a parent, the thing that I would say to them is, if you know your child and your child has been involved in sports or dance, or they've had the same group of friends since they were in grade school, they've always been interactive with the family, things like that. If you see those things going away, they're not interested in going to dance class anymore, their coach is dumb, they're not going back there, or they've changed their group of friends and those old friends are not there anymore. They isolate more in their room. They constantly are asking for more allowance, things like that.
Wow.
Those are all signs, but those are the signs within your children. They're signs within your house as well.
Huh.
If your teaspoons come up missing,
Oh, okay.
that could be a sign. If you find cotton balls in the bathroom, that could be a sign. People who are actively using, are very innovative about where they hide their drugs and the things that they do.
Right.
So, I always encourage parents to not only go to a Not My Child, which is held all over the county now, but there's a new video out that our state's attorney, Wes Adams, put out. And he sits down and has a very candid conversation with a young lady who's now been in recovery for 2 years about the places that she hid her paraphernalia and her drugs right under her mother's nose. So.
Now, I read about safe stations in some states. I know that we're very preventative here, so I'm assuming that we might have something along those lines.
We do. And again, I will forever be grateful to be an Anne Arundel County resident, because I feel like we are ahead of the curve on so much of this. And when the day that I was invited to the press conference, and when I watched the whole thing unfold, I thought, oh my gosh, so many more people will have a chance now. And I think the thing that makes it such a winning effort in Anne Arundel County is that the addict themselves takes the initiative to walk into a police department or a fire station. And I will tell you that most are going into fire stations.
Right.
But they take the initiative themselves to walk into the safe stations and say, I want help, I need help. And what happens right at that point is they are medically assessed, because EMTs, firemen are right there.
Right.
They are medically assessed. They call in crisis response, so mobile crisis comes out and they assess them for the mental health. If that individual says that they want help, but I can't really go because I have this legal issue.
Right.
At that point, they call in Wes Adams, and they work together. And Wes Adams, at the state's attorney, will get that case deferred. It does not go away. I think that people are under the perception that we're taking this criminal charges away, but that's not what happens. They're deferred.
Right.
Because really what we want to do is we want to get people into treatment.
Yeah,
get them the help that they're asking for, and then get them back into court with a clear head.
Because historically, they've been scared to get help if they have this record. And like, oh, if I do that, the judge says I'm going to go to jail right away.
That, and you can't go into treatment. So you couldn't go into one of the local treatment facilities. They won't take you if you have a warrant.
Gotcha. It's a catch-22.
So it's a catch-22. So, so
Wow.
that warrant or that charge is deferred. That way they can go into the treatment with a clear, everything is clear. So I think that, I think it is a great initiative in Anne Arundel County. It started April the 20th, and to date there have been 280 people that have walked in and asked for help. And I work closely with Mobile Crisis, Jen Corbin and Steve Thomas, and 60% of those people that initially walked in are still engaged in a recovery lifestyle.
That's
And
awesome.
what a great statistic that is.
That is fantastic,
That
yeah.
is.
If any of our viewers suspect that they have family or friends or even themselves are dealing with some, misuse of opioids, or what are some possibilities? What should they do at this point? If they're thinking that maybe this, what would you recommend?
So to the person who may feel like they have a problem themselves, please don't be afraid to ask for help. Go into a safe station,
Yeah.
ask for the help. The help is there, and you can get it. Just do it. Just go and ask for it. For the family member who may be afraid that that they have a son or a daughter or whatever, a family member, the first thing you have to know is that that person has to want the help. You can't force them. You just cannot force them. I can tell you that for myself, I was forced into treatment many times, but until I truly wanted to do it and I took the steps to do it, it wasn't going to happen. So the best thing that I can tell a family members, if your loved one needs help or wants help, go into a safe stations, call crisis response, and they can direct you the right way. If they don't want the help, the only thing that I can say is that take care of yourself so that you can be there and you can be healthy when they finally do ask for help.
That's an excellent point, because you can just get yourself all worked up and stressed out for something you have no control over.
So we have about 2 minutes left, and I think about the middle school and high school student that is sitting at home, possibly watching this episode, thinking about, I want to fit in, I'm not happy. What are some things that you would suggest for them in that prevention type mode? Or to a parent who has a teenager or a preteen that has not even had this discussion, on the lay of the land with the pill issues that we have nationally? Any parting advice or thoughts?
If I were talking to a young person, I would tell them that it's not the road you want to go down. I promise you, you don't want to go down that road. I would encourage them to get involved with a SAD chapter, their local SAD chapter. Get involved with those kids that are doing something to not only make themselves feel better, but to do some really cool things in the community.
Yeah.
To get involved that way. I say it all the time. I sit around at the coalition meeting that I coordinate, and as adults we talk about it. But I ask the kids all the time, just come out and talk to me. Tell me what you need. Because if I'm going to help you, I need to know what you need. And to parents, I would say get involved in those coalitions. Go to the PreventSubstanceAbuse.org website and look at the parent toolkit. There's some great information there.
Yeah, I know that the crisis response in Anne Arundel County, that number, we have first treatment. We're going to put them on the screen so our viewers will be able to see it. But even our students, I mean, if they see and they think that one of their friends is, go to their school counselor. And
Definitely.
then
Or
get help.
call crisis response.
Right.
They have gotten phone calls from students that have said, I think my friend is in trouble. Can you come out and help? And they will come. They will come out and help you.
They're amazing.
They are amazing.
We're very
Yeah.
lucky to have them.
Thank you so much for coming out
Thank
here. This
you.
has been a wealth of information
It's great.
for everyone involved, and I'm so happy to know that Anne Arundel County is kind of ahead of the game, but we still, as a group and as a society, we can knock it out. And thank you, audience, for joining us on this very hot topic.